Around here, we're ready for almost any emergency. But today, we're seeing more and more people use the ER like a doctor's office because they don't have a doctor. Waiting rooms are overcrowded, and everyone's costs are going up to pay for it all. That's why the governor and legislature have got to keep working to get something done this year. People need health care they can count on. If we don't make it better now, it'll keep getting worse.
I got into medicine to help people. In 35 years, that hasn't changed. But a lot of things about healthcare are changing, and not for the better. We've all seen it. People who have a job, work hard, and still worry about whether their families will have the coverage they need. That's just not right. And it's why it's so important for the governor and the legislature to get something done this year. Because people need healthcare they can count on, and they can't afford to wait.
I've been reading about the governor and legislative leaders in Sacramento tackling healthcare reform.
Glad someone's working on it.
We all want reform, but how do we do it?
Yeah.
Well, that's the tricky part. A lot of states rushed reforms and ended up with more people uninsured and higher costs.
Ah, those pesky unintended consequences.
Yeah. Responsible reform should control costs, use ERs only for emergencies, and make sure people with pre-existing conditions can still get coverage.
How about covering kids and giving us real choices in our coverage?
Exactly. And provide help for people who can't afford the entire cost of coverage.
But without hurting the system that already works for over 29 million Californians right now.
Let's not make mistakes like other states did. Let's do reform right.
Paid for by the Coalition for Responsible Healthcare Reform. Sponsored by Blue Cross of California. On the web at responsiblereform.com. That's responsiblereform.com.